Can you hear me now?
Yes.
Hello?
Yes,
Yeah.
ma'am.
Thank you. Thank you so much for the kind introduction, Karthik. You've been always very kind enough to introduce people. Well, I'm Dr. Neha. So I've completed my PharmD from India, from Deccan School of Pharmacy in the year 2015. Soon after I completed my PharmD, in the final year, I applied for research doing my PhD in the UK. I was quite keen to do research since I was in the third year of my PharmD, because I was from one of the very early batches of PharmD, and it was quite difficult. It was just a road with no light in front of you, because we had no clue what we are going to do after PharmD, because we just had like one set of seniors in front of us, and Dr. Karthik was one among them. I'm sure, when I say it was quite difficult for me to decide what to do next, it was even difficult for him to decide what next. But he's been standing in a place where he's guiding people. And yes, we did find some really nice seniors like him who actually supported us in a way to think about it. So when I was doing my second year and I was like clueless what to do, I was keen in observing people in the hospital. I saw many doctors working in the hospital, treating people, but there were questions which were being unanswered as well. So, I mean, I was thinking, what if I could answer these questions at one stage in my life and help all these people in getting an answer to these unsolved and unresolved questions? So, since then, I started questioning myself, what can be a good career option to answer these questions? And one of the first answer which came into my head was doing research. So I then started applying for a PhD since I was in fifth year of my PhD, and then I was quite lucky enough because I developed my own question to answer, and I was seeing quite a lot of patients. When you are in your fifth year and sixth year, you're allowed to do some sort of hospital postings. This is a part of your family as well. So I was working in BB Cancer Hospital in Hyderabad. And then I came across so many people who came up with breast cancer. And I was like, what do you think is the main root cause for breast cancer? And I was like, I started reading papers on breast cancer. And then there was one phenomena which came as a very good surprise to me, that breast cancer is a normal thing. But I say normal, it doesn't mean that it's a normal thing and everyone should have it. But it's a sort of a disease which many people have these days. But one such phenomenon was there were pregnant ladies who were coming up with breast cancers, and there were very serious breast cancers. Postpartum breast cancers were very, very serious. And it was HER2 positive all the time. So when I was reading papers, I came across this thing if you have a first pregnancy before the age of 24, you have a certain percentage of protection against breast cancer. And when you have your first pregnancy after the age of 35, you have a very high increased risk of having breast cancer. So it was pregnancy is the same physiological phenomena. Breast cancer is a disease which has got the same mechanism of action, and the way it develops and everything. Then why is this age causing a huge difference in the risk of having breast cancer? So it was there my question for the research developed. So this is how you kind of develop questions for your research and hypothesis as well. So I then developed my hypothesis and then wrote about 3 pages, which was nearly 1,000 to 1,200 words, I think. So it was a kind of hypothesis I developed for this whole criteria that why the age is causing the risk of breast cancer. And I then started applying for my PhD. Quite lucky enough to get into Imperial College London, which is one of the world's second best university. So it was just in a matter of 15 to 20 days that I got admitted into this. Then, when I was awarded the degree in family from India in the year 2015, I started this PhD in clinical medicine research at Imperial College. Once I applied my hypothesis, my research question was really appreciated, and I was then awarded a bursary to do my research, which was about 1 crore 44 lakhs. And presently, I'm a clinical research scientist and a teaching fellow at Imperial College London. I'm also a core member in the Cancer Genetics Group in the Department of Surgery and Cancer. This is the department where I studied all this breast cancer, age-related breast cancer. So whilst I was doing my PhD here at Imperial College London, I was given an opportunity to teach medical students and also life sciences students. In my academic achievements, I kind of bestowed first prizes by so many people around in India. When I was doing my family, I always made sure that I'm participating in presentations, oral presentations, poster presentations, and I was lucky enough to be bestowed by first prize by the Register and Convener of Osmania University. This was for demonstrating academic excellence throughout my campus life because I've been scoring. I've been the topper in the college from the second year of my family until the last year of my family. I kind of organized and led cancer awareness programs within the college campus as well. And then from the fourth year, when I started developing all these research questions, I kind of started writing research review papers as well. So, in my scientific contributions, I was awarded Best Speaker Award in various national and international conferences. One such conference when I came into UK was at the Royal Society of Medicine and British Association of Cancer Research. It was in the year 2020 when I was awarded by British Association of Cancer Research Breast Cancer Conference for my research I did on age-related pregnancy and breast cancer risk. I have many scientific publications to my credit in esteemed scientific journals like Oncogene, Oncotarget, Science, and Cell, to name a few. I'm a peer reviewer in Oncogene, and I've been a peer reviewer in many other scientific research journals as well. I was awarded at Wellcome Genome Compass Campus, Cambridge, UK, for the excellence in bioinformatics because while I was doing my research, I had to analyze the statistical data which came off at the end after doing whole genome sequencing. Next generation sequencing is one very very new area where research scientists are developing their skills in studying bioinformatics and analyzing genome related data. So I then did bioinformatics course here in the UK, and I was awarded for excellence in bioinformatics by Wellcome Genome Campus from Cambridge University. I was also a part of a few clinical trials in prostate cancer. I work with MRC here in the UK, and I also work with Barts Cancer Research Institute, and I work with Imperial College London. I also work with people in Spain who work on breast cancer, and then also in Austria. So since I've been a part of many cancer research institutes, I got an opportunity to work as a clinical trial member in prostate cancer and breast cancer as well. I've been having proficiency in teaching because I've started teaching since my day one of my family here. So I had an opportunity to create a module for students for developing their critical thinking skills. And this was done for the Faculty of Medicine for medical students of year 1 until year 3. This module was called Impact, which is basically innovative elective online module. I have professional associations with American Association of Cancer Research, European Association of Cancer Research, and British Association of Cancer Research as well. So this was about me doing all my research and everything. Another question comes in, like when I was doing my PhD, my professor comes to me and he said, like, you guys have Asians, to be honest, we Indians have got like very good foundation. So he said, like, when you've got like good base, why not get into medicine? I was like, it sounds like amazing, a very good opportunity to do medicine as well. So he said, like, in the UK, we have got graduate medicine where there's no age limit. There's no age limit for you to get into medicine, as whereas relatively when you compare in India, as after 21 maximum, you can't get into medicine. But here in the UK, it doesn't matter even if you're 50, you can get into medicine. And this graduate medicine is a 4-year course, and you have to pay quite a lot of fees. But then, if you have got good skills and experience, you can get scholarship as well. So I was lucky enough to get a scholarship for my medicine as well. I then completed my, and that this is how I got into medicine from Imperial College London itself. And I completed my medicine in the year 2020. It was in October I completed my medicine MBBS there, and then since I also had PhD, I was then promoted to a teaching fellow. Now I'm waiting for my upgradation to a senior teaching fellow at Imperial College London for the life sciences students and medical students as well. So that's all about me. Coming to what are the prospects of us working as pharmacists or medical doctors in the UK. Only a small number of pharmacy graduates basically go on to further studies directly after graduation. Now, this is because of a pre entry postgraduate qualification, which is not needed to practice as a pharmacist and is rarely advantageous when applying for jobs within the profession. So, pharmacy graduates who want a career in scientific research and development may study for an MSc or a PhD in the fields such as pharmacy, prescribing, or drug discovery and development, or in biomedical or chemical sciences as well. Graduates who then decide that they want to pursue careers outside pharmacy, they may undertake a relevant vocational or postgraduate course to broaden their skills and increase their knowledge of their areas. While before you apply for any profession in the UK, the one important thing which is needed is work experience. It's very, I know, like, it sounds very surprising. Like, you might say, like, I'm a fresher, I just graduated. How am I supposed to have an experience to get a job when the recruiters are asking me to have work experience? It sounds a very logistic and a legitimate question. But the answer to this is yes, you can have the work experience. Because whilst you're doing your PharmD, after fourth year, you don't usually have subjects to study a lot. The moment you start your fifth year, you can start working part time, gain experience in the field of areas you're interested in. I mean, like, move forward, get into those areas, work there, get work experience. By the end of your family, you should have a good amount of work experience. And you shouldn't be surprised when the recruiters ask you for work experience. Just say them, like, yes, I did my family. Plus, I also have work experience. And yes, I'm ready for a job from you. So it's kind of really important to get a relevant work experience to show the potential employers that you are enthusiastic and that can apply the skills you've learned during your course to the workplace. It's not that you're buttifying all that thing, memorizing everything, doing top, getting 90%, getting 80%, getting 75%, coming out of your family and saying that, like, look, I've got 90%, but I haven't got a job. But this is in your hand because you need to show enthusiasm at one stage in your life and then say it very confidently to the recruiters that, yes, I can apply the skills I've learned during my course to my workplace and I'll be a potential for your company, whatsoever it is. Most retail chains, they kind of offer some placements, summer placement programs in community pharmacies lasting between 6 and 8 weeks. I understand it's a bit depressing and devastating because some employers will recruit pre-registration trainees from these programs. You could find the experience in hospital pharmacy and other things. Although the most devastating thing is these jobs are unpaid work where you are shadowing people and working for that organization, but you don't get paid. But trust me, this is worth doing. This is worth doing. This is just for a few weeks or a few days, but you get experience there. Grab that experience. Don't worry about the money at that stage because once you start earning, nobody can stop you from earning. You could find these experience in a hospital pharmacy. So there may also be some sort of opportunities to do placements within the pharmaceutical companies as well, depending on your area of interest. If you are interested in working in Novartis, if you're interested in working in AstraZeneca, now write a good CV, write a good cover letter saying them, look, I'm a very good, very new trainee. I need to apply. I'm keen in doing research. I'm keen in doing drug discovery. I'm keen in doing any sort of thing you're interested, which is relevant to pharmaceutical industry. Write a cover letter to them. Tell them, show them your enthusiasm, and tell them that you can be a good placement for them. Trust me, such big companies, once you end your placement, they do have a job ready for you based on your work you have done, based on the potential you have shown throughout the journey working there as on placement. The experience in retail environment or voluntary work in a healthcare setting, this will enable you to develop valuable skills, including customer or patient care, and will increase your knowledge of over-the-counter medications as well. What the employer wants from you. The majority of community pharmacists in the UK, they work in large retail chains or they work in independent pharmacies of various sizes. Now, others are employed by small or medium-sized chain stores. GP surgeries also appoints you or healthcare centers as well. The majority of hospital pharmacists, they work for the hospitals within the NHS in the UK. It's not like locum. It's also possible for you to work for private hospitals. Qualified pharmacists, they can work as locum. When I say locum, they're temporary replacement pharmacists, either on a self-employed basis or through an agency. The pharmacy graduates are also employed in industries by private sector organizations such as pharmaceutical companies, food and drink companies to work in areas such as research and development, quality assurance, marketing, sales, and management as well. Other type of employers they include in the UK are the armed forces. You can work as military pharmacist for the Royal Navy, Royal Army, Royal Air Force as well. The other good areas would be universities and research institutions for a career as an academic pharmacist, where you can teach people, where you can progress your career as a teaching fellow, then senior teaching fellow, and then a professor. Trust me, it is very, very good honor to be a professor in the UK. I'm sure like it's the same in India and in other countries as well, but that's a lovely profession. Since I am into this profession, I really enjoy teaching students. And I think like this is a blessed profession. So one good suggestion I would give you that you can work in universities and research institutions. The other good area would be veterinary pharmacy practices. Now, you can work as a veterinary pharmacist with specialist practices, university veterinary schools, the pharmaceutical industry, the government departments and agencies, such as the Veterinary Medicine Directorate as well. So that's the high grade you get when you do specialization in veterinary pharmacy practices. You need to develop your CVs, as I said, gain experience as much as you can, go into placements, summer placements and everything. Apart from that, when you're coming to UK, there are quite a lot of options for you to do to work in the UK. You can work as a community pharmacist. You can work as a hospital pharmacist. You can work as a research scientist or a medical representative in pharmaceutical company. Other jobs which I can basically guide you through is clinical research associate. You can also work as higher education lecturer. You can work as medical sales representatives. medical license, medical science license officer. You can work as a pharmacologist. You can work as physician associate. Well, this physician associate is also one advancement which you only see either in the UK or in the USA. Apart from these two countries, this course has not been validated yet, not been approved yet. So, physician associates, they also work as GPs. Up until 2021, physician associates in the UK, they didn't have the right to prescribe medications. They only used to counsel the patients. They used to assist the GPs in prescribing. If there is overload of patients at some point, they used to guide the GPs. They used to share the burden of the GPs, check the patients, volunteer them, and counsel them for their diseases, counsel them for their medications, check the vitals, do the ward rounds, everything is such. But they were not given the rights to prescribe the medications until 2021. But luckily, in the UK, now you can prescribe medications as a physician associate as well. So that's one of the new stream, and this is an MSc course which you can potentially do after your pharmacy as well. If you're keen in getting into medicine, this is one such course which you could do. This is a 2 years course, and it has got like 3 semesters. 2 years course, 3 semesters. Not many universities offer this course. One such university is St. George's University in the UK. Bath's University also offers this course. Imperial did have this course, but now they have stopped this course for 1 year due to some potential reasons. Now they might just start this course again as well. Southampton University has got this course just in case if you guys are interested in doing physician associate course. This is MSc in physician associate, okay? The other things which you can do is product or process development scientist, which is a part of pharmaceutical industry again. And if you're keen in studying chemistry, then this is a very good area for you to work as a product or process development scientist. Regulatory affairs officer, this is potentially a new area in the field. And yes, we do have quite a lot of universities in the UK which offers this MSc in regulatory affairs. Trust me, this is one of the flourishing course which is taken up by many of the pharmacy students in the UK. And the majority of Indian students are also applying for this course. And since it's a new course, there's a high rate of acceptance at this point of time. I can't guarantee you within the next couple of years if they'll have the same amount of intake in these courses, because since this is a new one, they are kind of recruiting as many students as they can. So if you're interested in regulatory affairs, this is a good time for you to apply for MSc in regulatory affairs. The other is research scientist, which is again working as a PhD student, PhD, and working as a postdoc for years and years, and then becoming a team lead. The other one is a science writer. If you're good at writing, scientific writing, then this is a very good profession for you as well. Then you can work professionally as a scientific writer in many of the scientific institutions. You can also work for good pharmaceutical companies like AstraZeneca, Novartis, and so. The other one would be toxicology. If you're keen in developing your skills in pharmacovigilance, if you're being very good at pharmacovigilance when you're doing your PharmD, and you're good in studying toxicity of drugs, then this toxicology is a very good course. Most of the majority of universities in the UK, they offer this course to MSc in toxicology. Then this is a very good course for you to get into toxicology area and be a good toxicologist as well. So that's all I had to talk about different career opportunities in the UK. If you have any questions relating to this, please do come up with the questions. Happy to answer your questions. Thank you, dear.
can unmute and ask. So meanwhile, I'll show you something. Actually, there is Ganpati thing here and lot of background noise. Let me share. Can you see my screen?
Oh, yes.
Yeah. So, Dr. Neha, when you were talking about this, I recollected my family days when I was studying breast cancer.
I
The
love
reason I'm
it.
showing this is every one of us might have read this. The risk factors associated with breast cancer. And one of them, which you
True
were
that.
mentioning, nulliparity and late age at first birth, so greater than or equal to 30 years of age, reported to increase the lifetime risk of developing breast cancer. So we might have simply read it as one more statement, and if somebody has list out risk factors of breast cancer, wrote it happily. But the same thing you read, and that became your research question leading to PhD and all other great things which you are doing. So the reason I'm showing this is there are so many such aspects which can form a basis for your research question and which can set your entire professional journey based on just one sentence here. Okay. So in that way, actually, there are many such things in topics which we read. And
That's
the reason
very
I'm
true. I mean, like,
yes,
that's really very true. I'm sorry to interrupt you, but
sure.
this is all what happened. I mean, like, since now many of the family students says like, we don't see a future, we don't see a future. Let me tell you, we do see a future right in front of your eyes, but we are not keen enough to notice that and just pick it up. I mean, like, be sharp enough, be I would say just like be keen enough when you're reading stuff, when you're studying stuff. Don't just think about what you would be in the next 5 years, like when you're just starting your journey, because making your way out is more important. I mean, your whole journey is important, not just the final ultimate target. I mean, your whole journey will give you thousands of options. I mean, like when you're reading, read it carefully, what you're reading, what you're talking about. It's very easy. Like, trust me, when I used to write my exams in pharmacology in the second year of, I was like, what are the side effects? Nausea, vomiting, nausea, vomiting, nausea, vomiting. I just used to write it. But I never paid attention. Why is this nausea, vomiting coming up every time? Why is this coming? Why every drug has got this only side effect? Why only nausea and about vomiting? Why only nausea? Why only nausea? Never noticed it. Did you guys ever question yourself why every drug has got this side effect? Do you have an answer for that? I mean, like, this is an open-ended question. I mean, like, anybody can answer it. I mean, there are questions like this which comes up in your life. Try and answer those questions.
Yes, ma'am. So I agree. Okay, again, recollected something. So in Dipro, when you read, that is the textbook I was reading. There is a chapter called nausea and vomiting. In that, one of the subtopics was chemotherapy-induced nausea and vomiting. So you can find it in two places. One in the nausea and vomiting chapter, subheading chemotherapy-induced nausea and vomiting, and also when you read cancer regimens, they talk. So maybe, okay, this is a question for you. You can read about it and respond. So I will
Sure.
just add a couple of other things. So recently I was talking to one of my students working in a group which takes care of cancer patients. It is more of like a second opinion. Basically, patients approach them, they collect all the relevant information, including the labs, organize in a certain format, and then send it to doctors for them to see that information and then guide the patients to take good decision. So I was talking to her to see if we can add other component also, because these patients are having cancer for so many years, most of them. And right now the service they are providing is just connecting them to doctor after analyzing all their information, and maybe doctors tell them what is the next course of action. So what I got an idea is, because these patients will all anyways be on medication, So I was talking to this girl and asking to see if we can add another service on top of it, where along with the doctor, these patients will be connected to a clinical pharmacist also. And maybe we can go through the
Mm-hmm.
regimens and just tell them what side effects they can expect, what can they do to prevent some things which can be prevented. So it is still in the initial stages, but the reason I'm bringing this out here is there is a lot of great work happening in oncology that too in India. If it was some other department, maybe I would have ignored. But if you have good understanding about oncology, you can make a great career. So in fact, we are also associated with another group where they have
Mm-hmm.
developed a kind of a database where they compare two different regimens, let's say for a cancer, and see
Okay.
which regimen has better survival rate, which what is the potential of side effects for regimen versus one versus two, what is the cost. So they are creating this to help doctors take an informed decision. So they have done it for
Um,
cancer. I think such databases are there, countries like US, and also in India they have developed it, which is used by doctors across the globe. So they were asking us to create something like that for other regimens in cardiology, nephrology, etc. So, so I was all that was created by students from medicine background. So I was thinking, why not Fandis also made part of that project, which they agreed. So in that way, these are new things which we never heard when we were studying Fandi. Or okay, to be honest, I came to know about that maybe 6 months back. So even I was not thinking that we can do something like this, where it has great value to doctors and also patients. So overall, my point is, if you have a thorough understanding of any subject, especially oncology, now because so many innovative things are happening in India, you can like do great work. So Neha, over to your participants. If you have any questions, you can ask. If not, we
uh,
Yeah,
can.
yeah. Good evening,
Before
Dr.
I
Pratik.
can, I
Yeah,
Yeah,
Arshad,
keep
go
sorry,
ahead.
being
you can
Neha.
continue
connected.
now. You can continue, Neha. Afterwards, I'll do. Is it okay? I should start my question. Small query.
Please start your question. Yeah, I'm happy to
Yeah.
answer.
Good evening, both of you and all of you. It's good to hear about you, Neha, and your continuous journey, which was mesmerizing me and also motivating others, I hope. That's what the point. So actually, I'm working as pharmacovigilance department since 2 years, 3 plus
Mm-hmm.
years. I have completed my family in 2018 batch. So I was trying
Mm-hmm.
for UK itself, as Dr. Karthik also read about this one. So I'm planning for uh, moving to UK for further studies. Hope so. My goal was actually to enter into as OSPAP, which is a pharmacy bridge in between.
Yeah.
Uh, yeah, OSPAP. So after hearing you, I was recently I was working. I was trying to gather more information regarding drug discovery also as pharmacology or research field. So, as you have
Mm-hmm.
raised the point about masters in the discovery, just I want to know whether if we go, as we are having in UK, M research and also MSc. What I have gone to M research and I mean masters in research, which is of 2 years, and also MSc. So, which will be better, and what scope can be good if you want to enter into the research field as pharmacology field or this? Or I want if I want to go as bioinformatics also, I have gone to that. I have gone to few colleges which are providing for bioinformatics also, which is one of the core field for research data analysis. So just I want to know which will be the better scope as MSc the discovery can go or M research, or it is easy for us to get into the admission in those universities which are providing that one. Just I want to know from you. Uh, what will be the better for
Thank
my
you.
yeah
Thank you for the question, Arshad. That's a lovely question, to be honest, because there are two different streams, MSc and MRIS, like Masters in Research.
yes
But if
yeah
you really are keen in doing research and getting into drug discovery and being a part of a big pharmaceutical company, then I personally would suggest you to go for Masters in Research rather than going for MSc. As
okay
in MSc, you'll have you'll have semester
yeah
wise studies, and then you'll again do the same thing what you've been doing in your graduation. I mean, like reading it,
okay
passing it, qualifying it. when it comes to MRes, which is Masters in Research, there you will be having an opportunity to do research, live living research for 6 months in one lab, 6 months in one lab. So in the 2 semesters, you will have an opportunity to work in 2 different labs of your choice in your area of interest. And in that 6 months, that will be a kind of small span of PhD for you. You will think for yourself, you'll come up with a research question, you will get a hypothesis, you will do the research, you'll get the analysis, you'll do the bioinformatic analysis, and you also write a final thesis as well. So it's kind of a mini PhD you do. So technically, if it was me in your place, I would have done MRes rather than doing an MSc. I hope that answers your question there.
Yeah, just I want to continue for it one. Okay, after research, if we pursue research, then we will be entering into, we can move to our, core field, or how will be, or it will be next for again PhD, if we are interested, how it will be going, or directly we can go for and work in any academy, based upon the field what we are choosing, how it will be, are the scope will be more better, or how?
So, well, once you're done with your MRes, then you have an opportunity, because since you're doing your MRes, you have an opportunity, as I said, you'll be working in 2 different labs, 2 different projects. Yes. So if any project attracts you a lot, then you are free to do a PhD with them. Rather than you, it's not just you, the group supervisor might himself sometimes give you a chance to do a PhD. He might just offer you that, you have been a fantastic student when you were doing MRes with me. Would you like to continue a PhD with me? If he has got enough funding for his project, he might just give you an offer to do a PhD. And then you can, from there on, you can start doing your PhD, do a postdoc, get into a pharmaceutical industry, or whatever it is. If not that case, the plan B would be do an MRes, then go for a summer course. As I said, in the UK, you've got quite a lot of summer placements in pharmaceutical industries. So if you've got good scores and good work experience, and a good supporting letter from your supervisors whilst you were doing your MBA, then you can get into a summer placement. And that summer placement might be a key for you to get into a pharmaceutical industry. So that's A and B options for you. The rest is in your hand. Whatever you want to do.
Sure. Thank you for your comments and suggestions. I will go.
Pleasure.
I will consider. Thank you. Yes, that's it from my side. Thank you, Dr. Karthik.
If there's no question, I've got something to add to Karthik's last comment. Dr. Karthik was just mentioning about certain databases which were developed in comparing the drug regimens and the living spans of the patients, the death rates of mortality and morbidity of the patients. But let me tell you, I don't know how many students are there. I can see about 45 students there. So, if these students want to do some courses, some projects like this in PharmD, they can do it. Let me tell you, one such platform to start from will be Kaplan-Meier plots. It is called KM Plots, which is available, which is an open access databases available at the Google. Just type in KM Plots. You will get in there. You just have to register your emails there and then say from which profession you are. And then you will get ample amount of data available with different regimens there. And I'm sure Dr. Karthik, since he has got this thing in head, he might be a good person to talk about it. And then you can do these things. You don't have to pay anything for this. These are open access databases which are available for healthcare professionals. So please go ahead. If this is your final year project, this would be a great project. Trust me, it would be a great project.
Hello, madam. Good evening, ma'am.
Hi, Sikandar. Yeah, good evening, dear.
Good evening, ma'am. Myself, Sikandar from Karnool, ma'am. I have some doubts. Will you please help me out from those doubts, ma'am?
course, I'll try my best. Please go on.
Okay, ma'am. Ma'am, currently I'm a Form D intern, ma'am, from Karnool College, Pharma D. I have a doubt regarding master's course. After completion of my Form D course, I'm interested to do MS in clinical research, ma'am. But I'm confused with the specializations which we have to take in master's course, ma'am. That is, which specialization is good to MS after Form D course, and which course is best in masters currently well booming for the job seeking, ma'am. After completion of doing masters, is the CTC will be same as that of fresher Form D students? Is it is different, madam? Will you please help me out from this, ma'am?
Sikandar, very personal advice to you. I mean, like, whenever you're planning to opt for any option after your studies, I would say rather than looking into the market, look into your own self and question yourself, does this thing interest you or not? Because if you're not passionate about something, you wouldn't do anything in life. Trust me, this is my own experience. I mean, like, if you, I mean, like, you can't, I mean, this is a very lame question to ask anybody. Ki, what are the options for me to do? What do you want to do? Ask yourself. I
Okay,
mean,
ma'am.
are you interested in doing research? Are you interested in drug discovery? Are you interested in doing some other sort of research? Are you interested in toxicology, pharmacovigilance? What is your interest? And then from there on, we will pick up what is the best route for you to get to the highest place you can. I mean, like,
Okay,
don't
ma'am.
mind me telling that, but that's how you should plan your career.
Okay, ma'am. But I'm interested to do masters in clinical research, ma'am. But my doubt here is,
Okay.
after completion of doing master's course, we are going to do the jobs like PV, CDM, research, CRO, etc., ma'am. But the CTC scale is same as that of fresher, or it is different for master's candidate, madam?
It would be the same for both of them. The only thing is how well you get work experience is that matters, because some people do masters and have got no experience in working as a clinical research associate as well. They just read the textbooks and they qualify. But it's all about the extra work you do, the extra work experience you gain during your studies. So I wouldn't say that a master would be given an upper hand or you. I mean, like, even a fresher who comes out with a good work experience might be given a job rather than giving that job to a master student with no experience. So it all depends on your work experience. I mean, like, this is what I was emphasizing on. Get as much as work experience as you can. Don't worry about, like, you might be getting a job as a CRO or that. I mean, like, even that will give you some sort of information about how to access the databases, how to get research data, how to collect it, how to make SOPs of certain research documents. So, I mean, like, this is also giving you skills of doing research. So these are very hands-on skills you gain while working as a CRO. So please go ahead with that. I mean, if you want exact question, please do write an email to me about if any stream you're interested in. I might write back to you with what you can do and which college offers certain courses for that.
Okay, ma'am. Ma'am, companies are showing interest towards experienced candidates, no, ma'am. If the person is doing masters, of completion of masters means it is a masters postgraduate student is also a fresher to the company. Means
Of course they are.
okay, ma'am. For postgraduate student also, their companies are giving the CTC is same as that of freshers candidate, no, ma'am. Is it correct, madam?
Yeah, of course they do the same. Even if you have a PhD, not just masters, but you have got no experience, you will be treated just as same. It's only your degree which is like having a weight. That's it, nothing else. But if you have got no experience, they might just say like, we can't pay you enough. That's one of the answers many companies give. But potentially they are looking for candidate who can work and give to that company. They look for people who will have some addition. I mean, like, who will add on to the reputation of the company rather than just having like designations of people added to their company. They would prefer people with work experience. So everybody comes as a new fresher to them. The CTC scanning would be the same for all of them.
Okay, ma'am. But some sad thing is what is there, madam. For a fresher candidate, if we got a job first means then only experience will come later, no, ma'am. their companies are
This
maximum
this
companies
is
are
what I
asking
said. This is what I
asking one
said.
to
Once you're
2 years
doing
of
your
experience.
This is what I said. Whilst you're doing your PharmD, I mean, like after your fourth year, you haven't got anything to read in terms of subjects. You have got more of practical work to be done. This is the time, 2 years' time for you, fifth and your sixth year. Sixth year is all about your own project. So these are the 2 years where you can do some extra work. This is what I was emphasizing on. And I also said it is devastating that some of the times this work is unpaid. Not many companies will pay you during this time because they'll say you like, we are happy for you to come and shadow us. Most of the doctors might just come and say you like, come and shadow us in our clinic, come and shadow us in the hospital, but they won't pay you for that. But trust me, working unpaid and gaining work experience during these 2 years will fetch you a lot when you're applying for jobs. When you're applying for jobs, you will not stand with this question in your head that you won't get a job because you're a fresher, because you already have work experience. Do you get my point?
Okay, ma'am.
I mean, like, do you get my point? I'm sorry if it's not very clear. I'm happy to clarify it as well.
Uh,
Don't worry. I mean, like, sometimes you do get confused, but trust me, I
Yeah,
mean, like,
actually, we can
work,
connect again.
do.
yes, madam. Uh, in for
So,
instead of doing masters is waste of time, no, madam. When compared to fresher candidate, if you person do a masters means 2 years of time, and CTC will be given the same mean as that of fresher. It is a waste of, I think so, my perspective, waste of time doing masters, and after completion of masters, CTC will be same as that of fresher means it is just sad thing for a person who did masters.
What if a master's student has work experience plus he does master's, Sikandar? What do you think? What company would prefer? Just the work experience from a fresher graduate or a master's student with a master's and a work experience?
Work
If you are the
experience.
owner of the company, what would you do? Would you hire me as a graduate or would you hire yourself as a master's with work experience?
I think the person with the post graduation have some extra knowledge. I think so, ma'am, when compared to fresher.
Plus, he has also got work experience. So, studies are never wasted. But my only point is don't treat yourself less than anybody. Get some work experience and apply, start applying for jobs. You will get a job. And don't worry about the discrimination. Everybody has to start from the scratch. You will reach a point where you'll have nobody to compare yourself with.
Thank you, ma'am. Thank you,
so
Karthik.
actually, CTC or whatever should be the last criteria. They first just get something. And then as you grow, because I have seen many examples in India where people started with 7,000 rupees per month. Can you believe? But now they are heading clinical trial operations in more than 30, 40 countries. So don't worry about, at least during initial stages of career, focus should be on what should I do to get that opportunity. Don't really worry, okay, now I am getting this CTC versus somebody else getting some other CTC which is higher. So don't worry about that. That you can make.
Karthik,
So
sir, one thing, sir.